Busting bugs this winter needn't mean antibiotics. Most coughs, colds, fevers and sore throats get better without them, and overuse can cause more problems. So your GP will only prescribe them if they're really necessary. Find out more by downloading the Healthier Together app. It'll also let you check your child's symptoms, so you know when to seek urgent help and when self-care is the safest. The Healthier Together app, your little bug buster.
This is the North East and North Cumbria Providers Podcast, highlighting the fantastic work taking place across the region to provide the highest quality of care.
Hi and welcome to the latest episode of the Providers Podcast. I'm your host Harry Newhouse, Communications Officer for the North East and North Cumbria Provider Collaborative. Today we're talking about health literacy, a vital but often overlooked part of healthcare. It's all about making sure people can understand and use health information to make informed decisions about their care. Joining me are two people at the heart of this work, Strategic Manager Emma Davidson and Health Literacy Specialist Lorna Dawson. Together we'll explore how this regional programme began, how it's grown and how it's helping NHS staff and patients across the North East and North Cumbria. Welcome Emma and Lorna. How are you both?
Hi. Good, thanks.
Emma, could you start by telling us a bit about your role and how you got involved in health literacy?
Yeah, of course. So I've worked in the NHS over 20 years now. I had various different roles, mainly within training, continuous improvement and project management. And when I got asked as part of the project management work to do projects under the prevention work stream, I really enjoyed that because you could really see sort of the potential difference you could make to patients and communities. So I was really excited when I got the chance to apply for the health literacy role. And I suppose my job within the team. So we've got a work plan which includes loads of things. So we've got health literacy training on there, doing health literacy work across a whole patient journey, working with patients and communities to check that we're doing it right and developing standards and a supporting toolkit. And we've got a team of a very small team of people doing that work. So my job is to sort of oversee delivery of the work plan and to make sure that that it's sustainable and evidence-based, and picking Lorna's brains plenty around that and making sure that that we're delivering on what we've said we will.
She does a really good job of it.
And same question to you, Lorna.
Yeah, so I've been doing health literacy for quite a long time. When I think back, it's maybe kind of 6 or 7 years that I've actually been delivering some sort of health literacy training. So I started off in libraries and I worked for a while in a health promotion library, and we gave a lot of kind of patient leaflets out to like health workers who were doing stores and things like that. So I found that really interesting and I always wanted to write them, but that wasn't part of my job at the time. And then I went away, kind of qualified and came back, and that was kind of just before the pandemic, and I started doing health literacy awareness training, so raising awareness that kind of reading age is a lot lower than we think. And I really liked that, but I didn't really do anything about it. I was just raising awareness of the problem. So this job came up and it was actually doing something about it. So changing leaflets at the trust, so rewriting them at a reading age of 9 to 11. So I kind of jumped at the chance of doing that. And since then, it's really grown. So yeah, kind of the regional team's grown out of it. We've done some national work as well. So yeah. So because, and I guess I'm the specialist because because I've spent so long doing health literacy work, but I find the evidence behind what the team does, but I can also offer advice on how do you do stuff in practice, how do you do this in organisations, because it's very different kind of doing it in practice to just what it's like in theory.
Yeah.
So what is health literacy and why does it matter, especially in the NHS?
Yeah, so health literacy is around people being able to access, understand and use information to make decisions around their health. So really it's vital in the NHS because without that, how can they understand like the information they're being given and use it to make decisions that will help them within their care and well-being and things like that? How do we know that they're making that way getting people like consenting to treatment and things like that, and that they've fully understood it and things like that. So, and it does have a real impact. Research has shown that it costs the NHS quite substantial amount of their budget at 3 to 5%, and people may get help when they're more poorly, so it might lead to hospitalisation or might longer periods of time in hospital, things like that, or they might use services in the wrong way, and we all know the pressure the NHS is under at the moment, so it's just all adding to that. So without us knowing that they can understand the information they're given, how can we know that they're getting the right care and that they need?
Lorna, as you mentioned, the programme began at South Tyneside and Sunderland.
Yeah.
What were some of the early successes and lessons that you learned at the Trust?
So I think one of the really key successes, and it wasn't down to me, it was down to my boss, the public health consultant, was getting senior backing. So our chief exec, Ken Bremner, was really on board with it, and he actually did a video that was aimed at all staff, kind of saying that this is really important, clear communication is important, you all need to be doing it. So that made it really easy to come in and start doing change. So the public health consultant and a colleague kind of also got our trust values changed to read an age of 9 to 11. And I think that's a big statement showing the Trust's commitment. So yeah, having that buy-in at the top was really key to kind of getting change throughout the whole Trust.
And I suppose it's important to say, because Ken is the chair of the Provider Collaborative as well,
Yeah.
so as he's seen the successes that he's had at the Trust, to then be able to do it at a regional perspective.
Yeah, I think that's fair to say, and we've sort of like used the success of it's based on the success of South Tyneside and Sunderland that we've got the regional programme of work. I don't think we would have got funding if it hadn't been for the success on that scale, and obviously the influence that Ken had at South Tyneside and Sunderland is good practice that we can work on with other trusts. So it really helps us to talk to people about how they should get the buy-in, and it's all going to sort of feed into our toolkit and things like that to help others do the same as what South Tyneside and Sunderland did.
So how did it grow from being at South Tyneside and Sunderland to a regional programme across the North East and North Cumbria?
So so probably mentioned a bit of it before. So it's like we've used learning from South Tyneside and Sunderland, and obviously Lorna's the specialist in our regional team, which has been vital to sort of developing our work plan and thinking about what would work on a bigger scale. And we've sort of we're based a lot of our work plan on these things called the 10 attributes of a health literate organisation, which really tell you what an organisation needs to do health literacy well. And so our work plan is based on that, to see like what will work on a regional scale, and we're sort of trying to do the work on behalf of other people, so we're testing things out, and some things haven't gone as we thought, because we're the first regional team, I think it's fair to say. Some things have worked really well, so now we're able to share that learning so that other people like can build on from it, or do what we've done, copy what's been a success sort of thing.
Yeah, because I think some things it's been really easy to kind of like take on and like almost like copy quite naturally, but others, I guess, because like as Emma said, it was definitely the first regional health literacy team, and we didn't actually know what a regional health literacy team would do. So I think part of it has just been like, what does health literacy look like at that bigger scale? I think we had potential ideas of what it would look like in an organisation, like the 10 attributes. So I think like what Emma and the team have done is really innovative. So there was certain stuff like the training, which we could just scale up, but there were things like kind of the leaflets didn't necessarily. So we do a lot of leaflet rewriting. So we've got guides for that, and we've got a pretty solid understanding of what a good leaflet looks like. But as we went out into the region, people were asking us for lots of different types of documents. So we were like, okay, so kind of this is what the regional team needs to look into. Health literacy is not just leaflets, it's bigger than that. And I think that's where, so Emma's talked a little bit about the standards and the toolkit. That's definitely kind of one of the changes. So people have kind of said, yeah, what does this look like? Like, we need a tick list, not just for how to write a leaflet simply, but actually what to do as an organisation. So some of it kind of we were able to lift and shift. Others kind of we've figured it out from actually what people have asked us for. Yeah.
And it's fantastic that as a region we've been the first to sort of look into this, to get a head start in it. And so I presume lots of other regions will be sort of coming to you as a sort of basis of how have you done this?
Yeah, it's really nice to see. So other, probably the Northwest region, they're starting to do a lot more now, and they've got their own steering group set up. So we joined that to sort of tell them about our work and sort of give them a few tips and things, and what to avoid, what our challenges have been and things. And then we were lucky to be commissioned to do like a national piece of work, which included 2 national webinars. So that was like a sort of another opportunity to really let everybody know about the South Tyneside and Sunderland work, and then how it's been changed into, like, moved on to a regional programme, and then from that we still get a lot of people getting in touch from across sort of the UK saying, it'd be good to know more about how we've approached it. We're looking to build a bit of a team, and or we've heard about case studies where people have done health literacy work through another way because they haven't got a specific team. So yeah, it's really reassuring to see like the impact that people know about us down the country, and like sort of the impact that it's had, and
it just shows the importance of it being, of everyone being able to understand the information that they get.
Yeah, definitely.
We've gone global as well.
Oh yes,
we have.
What with?
So I think it was 2024. There was a global health literacy conference, and so we presented kind of some of our training.
Yeah.
We did a bit about the trust, and then also about kind of how do you do like a regional health literacy approach. So there was a conference poster. Yeah, so lots of people were interested in that because it was less kind of theory and more how do you actually do this, how do you put it into practice. So yeah,
it's really good.
So what kind of training tools and resources are available?
So we've got kind of monthly training sessions that we run. They're available online, they're free, anyone can join them. You don't have to be from the NHS, you could be from kind of like the local council or a charity, or just you could be from a school. And they cover kind of health literacy awareness. So what is it? Why is it a problem? Kind of a few little tips on how to make it better. We've got a session on how to write simply. So a bit of a kind of 101, if you could kind of change your writing and make it a little bit simpler, follow these 5 tips. And we've got a similar one for speaking simply.
Yeah.
That's not monthly. But again, it's kind of introduction to how do you convey information in simpler language, taking out the jargon, how do you check people's understanding. They tend to last about an hour, so it's quite easy to fit into your day. We also do stuff on request.
Yeah.
So literally this morning, I went to a team in Gateshead that did bowel screening. So we did kind of all of those back to back. So awareness, writing and speaking. So you can ask us to come and deliver it or deliver it online. And we do some more advanced stuff as well for kind of if writing is more part of your job. So if you're kind of admin or comms, you're the person who writes the letters to people or does the website. So we do a bit more in depth kind of how do you write simply, write at the average reading age, which is 9 to 11. And then we've been testing out stuff like Train the Trainer. No, I've covered a lot of training.
And then like you say, we've got a lot of tools as well, some of which we've developed or the trust has developed, South Tyneside and Sunderland before us, and others that have been probably already available for quite a long time, but people maybe weren't aware of them. So yeah, there's tools to help you write more simply. There's techniques that we've got videos on to help people speak simply. So using sort of the teach back and chunk and check methodology. They're all part. We've got a health literacy playlist which is set up on Boost Learning Academy, which is a good place to find all of these things. So that playlist has got, like I say, a variety of videos like how-to guides and bite-sized training sessions. We also recorded our own version, a regional version of the Language of Health video, which is really impactful. It just shows the impact that not speaking simply can have on people, or when they don't, how it can impact people if they don't understand what's being said. And it's basically stopping people in the street and asking them if they know what palliative means and things like that. And it's quite shocking the amount of people who just don't know what these words mean, but it's things that we just take for granted because it's just day-to-day part of the NHS language sort of thing. So yeah, there's all those tools out there, web-based tools, videos, all to help with writing and speaking simply. Yeah.
Like, we don't want it to be just us who does health literacy, really. It's kind of like everybody's job. So yeah, we're trying to kind of create or signpost to as many tools as possible. There's the Boost platform. There's also, if you literally just type in NENC health literacy team or regional health literacy team into Google, you can find our webpage, and that's got links to guides and tools and stuff like that. I'm just thinking as well, so there's a really useful tool, the NHS readability tool, which is really good for writing. So you copy your writing into there, and it highlights things in different colours depending on if your sentence is too long or if your word is too complicated. And I think people find that really useful.
Yeah. So what sort of feedback have you had for the people that have been on the training? I mean, I'm very fortunate enough to have been on the training. I found it very useful, and to be honest, it's a skill in itself. I really found it quite hard to actually get the sentences to where they needed to be. So what's the feedback been like?
Been really positive. The training, I would say, like Lorna says, it was something that we were able to get up and running quite quickly because we had a lot already there from the work that South Tyneside and Sunderland had done and built and on that, and it's been great. We've had really positive responses, so people saying, oh, that's phenomenal. It's a hard word to say. Saying it's vital, that everybody needs it, and that most people commenting that should be part of mandatory training and things like that. So really, really positive, and evaluations with people saying that they'll go away and make a change the way they write information and aim for a reading age of 11 years old and under, that they'll really think about the jargon and the medical terminology that they use. And we've trained over 2,000. That's not including the national webinars. So we've trained over 2,000. But what's really nice is that where webinars are still really popular and well attended. Yeah. So there was 20 on a webinar last week, and so that's really positive to see that. And continuing to evaluate well. So yeah, it's really nice, and it just proves that staff want to do it. So there's all sorts of drivers to do health literacy, and obviously we need to do it for the patients. It's the right thing to do. And then what's really reassuring on the reverse side is that staff want to do it. Yeah, and we were lucky enough to be able to pilot a session at the University of Sunderland with medical students, so showing the potential impact if we can get it into training before people start in their career. And that's something that we'd want to do more of, really. But yeah.
Yeah. And I don't know, we try and make it practical. A lot of the sessions are skills based, so that it's not just it's a problem. We tell people what they can do about it, and actually the things that you can do are really simple. It's about simplifying rather than making stuff more complicated, and they're also quite often they're free, because we can change the words that we use, whether it's speaking or writing. So it's quite nice to be able to go away from training and be like, oh, I can actually do that straight away. And we try and get people to think about how would this look in your job. So I think that's what made people kind of like it quite a lot. It's quite practical.
I suppose one of the main reasons for the programme is because it links closely with health inequalities.
Yeah.
So how is this work helping to address that across the region?
Yeah, so like you say, it's health literacy is one of the biggest drivers of health inequalities, but like Lorna was saying, it's something that we can do something about. Quite often it's hard to see one thing that you can do to really address those health inequalities in an effective way, but we know the average reading age is between 9 to 11. Historically, we don't write like that, but our aim is that all written information should be written at that reading age, so that we know that people will be able to understand it, that's hitting the our population's needs sort of thing. So yeah, that's probably the big thing. And even the speaking simply as well, obviously we haven't got that sort of the reading age to sort of measure that on, but just like Lorna says, using the practical like techniques and skills that they learn at the training to really like sort of change the culture of how people talk, and making them think twice about using complicated language, and really making sure people have understood before they've left clinic appointments and things like that. So yeah, it's just really through those ways of like changing how written information is, changing how information's given when you speak to people, will really sort of start to impact and like sort of address those health inequalities as well.
How does this programme align with the NHS long-term plan, especially around prevention, personalised care, and obviously, like as you mentioned, reducing the inequalities there?
So I think Emma already touched on kind of the idea of personalised care and shared decision making when she kind of gave her introduction of what health literacy is, because I guess if people don't understand what's happening to them, they can't really express a choice. So you can't necessarily personalise care because people don't know what's going on. And a lot of the time, so we go out into communities a lot and talk to people, and they basically say they're too scared to say that they don't understand, so they just nod and say yes to whatever the kind of doctor or healthcare professional is saying. And that's not really kind of personalised care. So if you're writing in a way that people can understand, they can kind of express their kind of like the choices a lot more easily, and actually make informed choices. And so you will get kind of personalised care. I guess with prevention as well, so there are studies saying that kind of people with low health literacy, so who struggle to understand health information, are less likely to engage in things like healthy living campaigns and preventative campaigns, so things like immunisation, screening. So kind of those real kind of primary preventative things, if people kind of understand kind of why this is important and it's told to them in really everyday ways, kind of right from the beginning, prevention is starting. And there's things around self-care as well. So we send a lot of people home with kind of instructions, and if they can't understand those, then they can't do self-care, so they can't prevent themselves kind of getting worse. So kind of there's a lot that just changing words on a page can do, or kind of speaking simply. And one of the things that we say is that kind of health literacy and speaking simply, it's not just about patients, it can also affect staff as well. So kind of in terms of inequalities in employment, at the Trust we did a pilot of changing the information that was given on a certain job advert, because the qualifications on that job advert, people didn't necessarily need kind of like GCSEs or kind of even A-levels, but the way that job descriptions have been written in the past is really complicated. It could be degree level, and like, why are we writing that way when we're not asking for those qualifications? And a lot of the people who came to those interviews were from our more deprived areas, and there's a link between kind of living in a deprived area and having low health literacy. So it's reducing those inequalities in kind of staffing, or being able to employ staff from kind of all walks of life.
Brilliant. So for anyone listening who'd like to explore the resources and training that you've mentioned, where's the best place to find out more?
So like Lorna mentioned, we've got our webpage, so if you sort of search North East North Cumbria Regional Health Literacy, it'll come up on our Integrated Care Board's website. So we've got a page on there which links to lots of other ones, and there's Boost Learning Academy as well, where all of our training can be accessed, and a lot of tools, our toolkits as well. And then there's plenty of other places, isn't there? I've went blank there.
No, it's fine.
The community of practice, that was it. So we run a community of practice every quarter, and that's a really good opportunity for anybody who is interested in health literacy or is doing work in health literacy to come and join. There's a meeting that people can come along to and hear what's going on across the region. It's changed to a national community of practice now, so again just gives you more scope to hear more about what's happening across the country. And then there's a supporting NHS Futures page that goes along with that community of practice, so people can find out a lot more on there as well. Or they can get in touch with us via email as well, which is sasft.nenc.healthliteracy@nhs.net.
That brings us to the end of this episode of the Providers Podcast. A big thank you to Emma and Lorna for joining us and sharing their insights into health literacy and the fantastic work happening across the North East and North Cumbria.
Thanks.
Thanks for joining us for this episode of the Providers Podcast. Hit subscribe to keep up to date with the latest news and catch up with what we've been up to on our website and social media pages.